Hello and welcome to CDAO Magazine interview series. I'm Neel Butala, co-founder of HiLabs and a cardiologist at Mass General Hospital and Harvard Medical School. And we're partnering with CDAO Magazine, MIT CDAO IQ, and the International Society of Chief Data Officers in a series of interviews. Today I have the pleasure of talking with Ashok Chennuru, the Chief Data and Analytics Officer at Anthem. So we're going to dive right in here. I've increasingly heard of some health plans using machine learning for claims payments, which can also impact the quality of care. Have you or Anthem explored that area at all?
Yes, Neil. Anthem has invested in machine learning in claims processing, for speeding up claims and improving the accuracy. This was done by creating our own data and data science platform capabilities specifically. We have plans to expand this platform to include more data across the enterprise so we can drive more value from our existing machine learning models and come up with new high value ones. This is likely a more opportunity to leverage, the accuracy of claims payment through pattern recognition and anomaly detection. It's critical for health plans to pay providers accurately and pay as fast as we can. This streamlines operations for us and provides satisfaction to both our members and provider stakeholders. We have, started to pilot some of this over and under payments, activity, with our partner HiLabs, and the promise, and has shown some promise in the pilot market. Our approach is to, expand this across all markets later this year.
Great, perfect.
So Neil, thank you for a great conversation so far. It's only fair to, ask you a few questions, as a practicing physician, and also, having experience as an entrepreneur and great knowledge on how data and analytics impacts the provider world. Can you share, some examples or opportunities as payers where we can really partner, with you and kind of make the life of the provider easier?
Sure. Thanks, Ashok. Happy to discuss. So probably you mentioned previously of gaining timely insights from plans is actually a key pain point for us providers. Often providers don't have a complete picture, of a patient's medical history, since many times, they may see other providers not affiliated with each other. The plan, however, via claims data actually has that critical information. As mentioned, the insights and history needed typically take weeks or months to actually reach providers, which is often too late for us to meaningfully use that information to impact patient care. I think health plans have an opportunity here and really could help providers and patient care, both by speeding the delivery of that critical health information to providers, and also providing insights from their vast data analytics capabilities, especially as plans begin to receive more clinical data from their provider partners, as Anthem, you guys have done with your Epic collaboration. I think, in particular, the work that Anthem is doing internally and in collaboration with HiLabs via its MCheck platform to monitor and improve claims, provider, and clinical data should help Anthem and other plans deliver better insights to providers in a timely fashion.
Great answer. And we are looking forward to that collaboration as well and scale this across the country. Any other opportunities for us for payer-provider collaboration, Neil?
Great. I think there's two big domains in my mind. So, first and foremost, I think data interoperability and integration is a key challenge in day-to-day patient care. So doctors are probably one of the few professions left stuck relying on fax machines for doing things, day to day. And, it'd be great if we could actually have a full history of each patient we see. But inevitably, some of these medical history and records don't come through. And we're essentially working with patients to do our best to bring everything together and make the best decisions possible with the limited information we have. A health plan with a full view of a patient's history can really make an impact on patient care. A health plan has the scale and the resources to really integrate these data sets, ensure they're of high quality, and then actually deliver that in an easily consumable fashion to clinicians at the point of care.
Right.
I think that's sort of one key piece. And then, bigger picture, Another area we struggle with, especially in academic medicine, is sort of leveraging interoperability and integration across providers to enhance clinical knowledge, advance clinical knowledge altogether. So, providers actually need vast, high quality data to generate real world evidence to actually know which treatments work and which treatments don't for the patients we actually see in clinical practice. Today there's more standardization, and better collaboration across universities to share data. However, and there's appropriate permissions for this. However, actually executing on this often depends on EMR systems and agreements between parties that often take time to get together. So in an ideal world, that'd actually be effortless, fast, and secure for providers to transmit large data sets that are de-identified to each other for research purposes once everything's been approved. And if plans can actually integrate these data and serve as that key piece here and ensure, these data are high quality, this can really accelerate and transform not only how we deliver care, but actually how we generate clinical knowledge to treat patients and advance disease care. And, thank you, Ashok, for joining me today. And please visit cdomagazine.tech for additional interviews.